All right, we want to welcome everybody back to listening into our recommendations and hot tips from our trusted resource partners. Today, we are so lucky to have Natalie from Utah Valley Dental Lab, one of our very long trusted resource partners with Utah Valley Dental Lab. They do so much work with the Crown Council to help us and to they've helped us develop our new young dentist program here. We're just thrilled to have Natalie and to be partnered with Utah Valley Dental Lab. Natalie has just an awesome tip to share with us today, and I'm going to turn the time right over to her.
Thanks, Spencer. We were excited to share with everyone today. We're excited to see you. We're going to start with, we're calling this lab etiquette. What you can expect from your lab, how you can help us help you. So I thought I'd just mention a few things that we can all do together, and I'll start with what you can expect from your lab. While the CDC does indicate that it's the dentist's responsibility to make sure that any restoration or anything that they're delivering to a patient is properly cleaned, it's reasonable to expect that, like us, your lab is not providing you with a contaminated product. So that's reasonable. If you have questions, call your lab and see what they're doing. We're happy to tell you what we do to keep you and your patients safe. So you can expect that from us and know that we're going to give you our very best. What you can do to help us is to kind of do the same. It's things that all of us are already doing for the most part. It's just cleaning things before they send them out. But I have a couple reminders that might be helpful for you and your team. The first is when you send in actual physical cases. When you send in scans, it's awesome. That makes it really easy. We're not sending anything back and forth. But when you send us a case, will you remind your team to put your lab slip in a separate bag? If you're sending any sort of a file or anything that we can't sanitize, put in a separate bag. You may not think about it, but when this comes to us wet, it can distort the information. And then we have to call you and ask you to explain, and just send it separate, it keeps it clean, and then we can sanitize this the way we want to. When we're sanitizing, when you're doing it in your office, we do ask you to please rinse it off. If nothing else, rinse it off first. Again, we go back to the CDC, but they do say that the very best time to sanitize is immediately after you remove it from the patient. You can rinse it then and then go ahead with whatever system you're using to sanitize, but do it immediately, then send it to us. We're grateful for that help. Everyone uses something a little bit different. So here's my tip for today. Most of us are familiar with cavi wipes, and your team's probably seen, they call it a 2-wipe process, and none of us really know why it's a 2-wipe process. So here's my tip. It's for a very specific reason. The cavicide can't get to any pathogens. It can't penetrate if there's a barrier to it. So the first wipe is always to clean. Whatever you're cleaning, if it's your handpiece, anything, the second wipe is actually sanitizing. So remind everyone, go through once and then go through again, and that's how you know it's taken care of. If you're using anything, other different items in your office, for your own in-lab at your office, a lot of people still love sodium hypochlorite. It's the most cost-effective way to go, but here's the reminder. It's a 1 to 10 part, so 1 part bleach, 10 part water, spray it. We recommend you never soak any impressions, spray them, leave them bleach. That's a 3-minute set time or wet time. You want the impression to be wet for 3 minutes. If you're worried about some of your impressions being wet that long, especially if you're using an alginate, we know that they're hydrophilic and we don't want them to absorb the moisture. You can always go to a hydrogen peroxide. The reason is that this is only a 1-minute wet time. So if you're concerned, some people are concerned there's some acidity in this, you're probably okay. If you haven't been having trouble in the past, you're probably okay. The tip on this is it's a 2.5, let's do this, 2.5 water, half part hydrogen peroxide. So it's a little bit different than the bleach, and that's going to give you good results. I hope that's helpful. If you have questions, call your lab. We'll tell you what to do, and if what you're already doing works, keep doing it. And we're excited to be getting cases and talking to all of you again. So thank you, Spencer. I hope that was helpful for everyone.
Yeah, fantastic, Natalie. And so everybody knows, all of Utah Valley Dental Lab's information is here in the body of this email. Reach out to them. They are as good as you get. And Natalie, thank you so much for the partnership, and thanks so much for joining us today.
Thanks.